Hello, fellow colleagues. My mother and father taught me as a child to respect everyone, regardless of their background or circumstances. Jesus also taught the values of respect and tolerance. He welcomed, accepted, and treated all people with respect and love. The bottom line is that I believe that it is a basic human right for all of us to live in a world of mutual respect and civility. Abuse and violence of any kind, particularly verbal and physical abuse, whether perpetrated by one of your colleagues or by a visitor or by a patient, is a horrible form of disrespect. As such, this behavior will not be tolerated in our organization. Please escalate any concerns that you may have about abuse to your supervisor, manager, or director so that we can investigate and move forward with action to stop this behavior in its tracks when it occurs. Your senior executive team can also assist in addressing this behavior. Part of our true north is about taking care of each other, our colleagues. We care about your safety. We will work very hard every day to make the University of Maryland St. Joseph Medical Center a violence and abuse-free workplace.
We have all attended the Language of Caring course. Within this class, we learned words that work. I encourage you to use the Language of Caring skills frequently and practice them. But oftentimes, they're difficult to use when you're assaulted or verbally abused. This video will help you have words that work at the ready in these situations and get guidance when your words do not work. If a family member or patient is argumentative with you, calls you names, or is disruptive, use these words that work. For instance, "You sound really upset right now," or "I'm sorry you're experiencing this." "I'm having a hard time focusing on giving really good care to your family member with you yelling at me," or "I don't want to make a mistake during this important procedure. Please take a moment out of the room while I do this important work. I'll be out shortly to talk to you. Again, I'm sorry you're experiencing this." It's ideal if someone else can do this intervention versus the person who's getting yelled at. It's much easier for a second party to intervene versus the person being verbally accosted. If someone else responds in your behalf, they should say, "You sound really upset right now," or "I'm sorry you're experiencing this. The staff is having a hard time focusing on giving really good care to your family member. Please step out of the room and talk about your concerns." I really want to help you get through this difficult time. Notice the heart, head, heart sandwich. Ideally, you want to get to the root of what the patient or visitor is upset about. It's usually not care you're giving, but the circumstances they find themselves in. They may be frightened or worried. They may have had a bad experience in the hospital. They may feel guilt. They may have relationship issues with the person who's ill. This would be the time for the second party to reassure them of how expert we are with giving care. The only way to get good at this is to practice, practice, practice.
"You're an awful nurse. I can't believe they let you practice here. I don't like that you're poking and prodding at my father. Get out of here. Go get your manager. I need to talk with somebody."
It's often nice to imagine making security intervene and taking your visitors away. However, the better approach would be to bring your supervisor in with security backup and a show of force, and perhaps using the idea that we will call police and have the visitor removed for trespassing because of this behavior.
"You're an awful nurse. I can't believe they let you practice here. I don't like that you're poking and prodding at my father. Get out of here. Go get your manager. I need to talk with somebody."
You seem upset. I really want to hear what you're saying, but it's difficult when you're screaming. Maybe we could step outside and discuss.
Hey, Dad, I'm so sorry. I have you here in the hospital. I didn't mean to have you here.
Hello, how are you today? Oh, are you recording me?
I want my lawyer to see how you're treating my father.
Oh, I'm sorry, I don't give consent to be recorded.
I have a right to record this.
Well, I'm going to go ahead and step out now until you stop recording.
If you're being recorded, remember, Maryland is a two-party state, which means both parties need to consent to being recorded. You do have rights. Unfortunately, we cannot take a person's phone away from them. Notify your manager, who should escalate it to the director of nursing or nursing supervisor. If it becomes a bigger problem, the administrator on call should be notified by the supervisor. Although these dramatizations aren't nearly to the level of abuse that you have received, it's helpful to see words that work in action to help you learn how to manage these situations. Sometimes, when you're getting bullied, it's better for a third party to intervene. Please keep in mind and rescue your colleagues from abuse. Here's another example of being bullied.
Why didn't you answer your page? You are never answering your pages. How can I take care of these patients when you're not responding? What kind of doctor are you? Who gave you a license? Why didn't you answer your page? You are never answering your pages. How can I take care of these patients when you're not responding? What kind of doctor are you? Who gave you a license?
Grace, you sound upset with me. I'm sorry, I was speaking to another patient and couldn't answer my page. Please don't speak to me so harshly. I really don't appreciate it. Now, is there something I can do for you?
There are several tools that we have to help you identify violence. First is the violence checklist. It's an evidence-based tool that can be easily completed by just looking at your patient. Place the green sign on the door, which is used to inform all staff about a potential issue in the room. We also have posted signs in many other areas to tell patients and visitors what our expectation is around safety. Oftentimes, medication is the best treatment for agitation and aggression. There is a convenient order called sjmc supplemental that is available in Epic for use. If your provider is not cooperating with providing a PRN, please escalate to your manager to further escalate to the chief of medicine or hospitalist lead. Your opinion matters. This easy algorithm is available for guidance around medication ordering. There are many items in the room that can be used to hurt you. Please look at the safety environmental checklist that is available on the suicide protocol to ensure your room is free from hazards when you have a violent patient or a suicidal patient that you're monitoring. This is important to keep you safe and the patient safe. There's absolutely no expectation that you endure abuse here at St. Joe's Medical Center. Please escalate verbal assaults, physical assaults, and/or manipulative behavior to your manager, who will further escalate to an executive. We have developed an algorithm to manage this type of behavior. Please use it. It's located in Policy Gen 24, Management of the Patient at Risk for Violence. In the past 6 months, several patients have been removed from the hospital because of this type of behavior. It will be addressed. There are several good questions to ask to figure out how to address the abuse. Does the patient have capacity to make decisions and understand the outcome of their decision? Does the patient understand the behavior? Can the patient change the behavior? Is this willful behavior? Is there imminent threat to life without treatment? When answered, the type of intervention becomes more clear. Choices include medicate differently, change the level of care, add an observer, create a behavioral health plan, or discharge the patient. For immediate assistance, call a code green. If during the code green you need a hospitalist to prescribe medicine or restraints, call them to come immediately to the code green to establish a medical plan for the patient. Make sure your manager or the nursing supervisor knows if there's a lack of response from the medical team. The manager and/or supervisor will decide how to proceed with escalation. It's best if your manager is involved when we escalate to the next level of provider. In the protocol for managing difficult, disruptive behavior, we have behavior plans that can be put into play. This intervention is done at a higher level than the nurse at the bedside, either by provider or by an executive. In addition, we have a behavioral contract that may be used for those patients who misuse substances. This contract should be generated by the attending provider once they are an inpatient on the unit. Finally, alcohol withdrawal, otherwise known as Delirium Tremens or DTs, is a medical emergency. Please call an RRT immediately in this event. Don't wait for a psychiatric consult. The substance abuse assessment should always be done on admission. And if a patient has reported that they have misused alcohol and yet their alcohol level is 0, please be concerned. Withdrawal usually starts within 72 hours of their last drink. Ativan is the best treatment for a CWA score of greater than 10. CWA scoring should be done every 4 hours. Once in full delirium tremens, this patient is better managed in the ICU. Healthcare is a very stressful career. St. Joseph Medical Center has implemented the RISE program to help you. A peer is on call 24/7 to provide care and support to our staff who've experienced stressful events. This is an opportunity to talk about the event confidentially with no repercussions and without judgment. please consider using the RISE program.